Sorry about that, ladies and gentlemen. Technology is sometimes, it just messes up. So I guess that's all we can say. And it looks like we lost the first part of our video there, but we're back on, and so we're going to continue on, and we're going to hear from John Weimer. He's with Kettering Health Network, and he's been inside the healthcare industry for over 20 years. He is the Vice President of Network Emergency, Trauma, and Operations Command Staff, and the Operations Command Staff. So when you think about emergency preparedness, you have an opportunity to hear from one of our professionals inside of this community, if not in the nation. So with that, John, you come up and share.
Thank you very much. I appreciate it. I'm going to grab some of the hand sanitizer here to the side. So we'll start that and we'll keep going here. So I just want to thank the Dayton unit of the NAACP for inviting us to come and talk about it today, and they've given us a list of questions. So the first one up here, it says, you've established a hospital incident command center, and how does that benefit our patients? So really, when you think of normal operations and what are things going on, we enact incident command centers when we're doing work that's abnormal, it's different, and it's a way to get information from the people at the front line to leaders who need to make decisions. And then as we change policies or we need to enact different practices, that way we can get information down. This is unique times for all of us. We've prepared for this for years, but the reality is for most of us in healthcare, this is the first time we've ever seen this kind of an event take place. You've heard that from some of the previous speakers today. We don't have herd immunity, and there are other pieces that we just don't have. We don't have immunizations available for this. So it's just important that we create structures that we can convey information as fast as possible. The other question that they gave here, it says, how are you working with other healthcare agencies to combat COVID-19? No matter your role, your title, your location, right now we are learning information so fast from whether that be China, whether that be Italy, whether that be here in Dayton, whether that be nationally. The other day we had a phone call with a hospital in Singapore to understand what were some of the things that they were doing. Today I've talked to 4 other health systems throughout the U.S. To gain knowledge and lessons that they've learned. I've been talking to all of our hospitals here in the Dayton area at least every other day. What are you seeing? What's coming in? What are those pinch points that you're hearing from your staff and from your care providers? Whether that's the 9 health departments that we're working with, the CDC and the World Health, it is all about information sharing. And that's important for all of us to realize. The more we share, the more we can learn, and the quicker we can overcome this. It says, what are your plans if patient volumes grow due to staff shortages? This is one of the main things that we continue to hear about, flattening the curve. The goal here is that we don't have that spike in disease and that we don't have that spike of people having to come in to be admitted into our hospitals. We have a finite amount of resources. So what we continue to do is here locally is we develop, different stages and plans for what that looks like. So that can be anywhere from closing down areas that aren't needed, which that's what we've done recently. You saw that with Governor DeWine's mandate to cancel elective surgeries. Okay, we got a battery issue here, so I'm just going to hit close on that. We're learning all kinds of new technology and new processes today. So that was our first thing we did. We constricted our services that weren't needed. That gave us more space in our campuses. The second is we started to look at areas that we typically didn't operate. We want to get those up and running, which we're doing, and hospital systems throughout the U.S. are doing, and I know all of us here locally are doing. The third we start going into is what do we look like for staffing, and what does that look like? How do we get those in? So we look at people in different roles, different aspects, people that have retired in the last 5 years. that are still competent, how we can bring them in, how can we share across health systems. With our surgeries being reduced, we're looking at how we can use all of those clinicians in different roles. So those are just a couple of things that we do, and then we look, if we have to get into, we really do see that spike to where it overwhelms the resources here local. We've already partnered with all the hospitals to say, where do we set up alternate care sites? How do we staff that? How do we bring in volunteers? And how do we create that different work? That's the great thing about the Dayton community and Gadaha, Montgomery County Health, is despite the health system and despite your role, we're all here to care for our communities, and we have to have those conversations and those dialogues. Next one it has on here, it says, why shouldn't people who have symptoms of COVID-19 just show up to the hospital? I'm going to go back to our earlier presenter, Felicia. She was right on point with that. We don't want to overwhelm the resources that we have. We put people at risk that don't need to be at risk, whether that's if you're asymptomatic or you have other healthcare workers or you have people in waiting rooms. We want to make sure that you care for yourself at home when you can. You work with your primary care physician, or you work with a health clinic or an urgent care or an on-demand clinic. And then when your symptoms get to the point where you can't be managed, then that's when we need to seek out emergency services, and then we bring you into that hospital for admission. But it's important in these periods and these times that we're working through this pandemic that we all use those resources wisely, and we make sure that we keep all those communication channels open. It says, what advice would you give to people to avoid getting the spread of COVID-19? So you can't see it, but behind me, as the county or the commissioner, as well as Felicia, as well as Daryl, all said, basic things: wash your hands, sneeze in your arm, stay away from people, and keep things clean. And just take care of yourself in general health wellness. Make sure you eat, make sure you're getting rest, make sure you have a good diet, make sure all those underlying health problems that you've kind of put off, make sure that you're addressing those and that you take care of those. But it is really about social distancing, keeping your hands clean. Felicia talked about the 20 seconds, happy birthday twice, sneezing into your arm. Those are all the things that prevent the spread of this disease. It's not a vaccine. It's not a medication today. It's really those things that we learned back from our moms and our dads and from our community leaders and our church leaders. It's the stuff we learned in kindergarten. That's what really will help us flatten that curve so that we don't overwhelm our resources. It says, how important is it for Governor DeWine's mandates? He has really let out on this, tough decisions, great consultation from leaders throughout the state, whether it's health departments, health systems. Whatever we can do to limit that spread will pay off in dividends on the back end. Right now, I know some of us are going to 2 weeks that we've stayed at home or we've tried to self-quarantine. We have the new order that went in place today. But again, we talked about faith, family, and work. There are still ways that you can have faith in your life and not go to church. You can have WebExes. You can join a Facebook Live. Just as Daryl's doing today, call, reach out to people. Still keep those social interactions, but keep that distance. We have a great thing with social media, and we need to really use it and adopt it today. The other is, is that family, and that family goes beyond just our relatives. You have family and healthcare workers that might live next to you. When you go out and get a roll of toilet paper or some milk, think about them. They're coming into work at 6 a.m. They're getting home at 10 o'clock at night. Grocery stores are closing. They might not be there when that got delivered. So it's just taking care of our friends, our brothers, our sisters. The lady that lives next to us that's 90 years old that can't get out. When you go out, this is where we need to embrace humanity, and we need to take care of each other. And it's those small acts of kindness through our faith and through our family that will get us through this. It says, the last one here, it says, do you have knowledge of where essential employers can obtain personal protective equipment for their employees, especially hand sanitizer? So I know you heard from our governor and heard from our president yesterday, the federal proclamation of not being able to hoard any of this equipment or any of these supplies. It is hour by hour. You can go on Facebook, you can go on social media, you can tag friends that will tell you, hey, this facility just got a shipment of hand sanitizer, this place just got toilet paper, this place just got gloves. But this is where we all share that information real time as health systems. We have other vendors that we typically don't use that are reaching out to us. We're creating collection sites. We have people making mask covers. We have people making mask shields. And this is where when you're home and you need something to do, reaching out to Goodwill, we're collaborating with them. They unfortunately just had 600 people that they laid off. So partnering with them, people can stay home, create this. We don't need it today, but we want to have it now. So if we do see that spike, we've got it and we're ready. Because the worst thing we could do is say, okay, now we need it, and it's going to take us 3 or 4 days to get it in the chain, get the teams working to do it, getting the inventory and getting that developed. So just appreciate the opportunity, Kettering Health Network, as well as all the health systems, and Derek for setting this up. It's a great way to continue that conversation, keep that social distancing, and keeping us all healthy. Thank you.
Appreciate that information, John, and you've given the citizens here in Montgomery County a lot to think about from an emergency preparedness standpoint. Lastly, we're going to hear from, let me get off this other screen, might as well go ahead and close down this computer that just crashed on us here, and let me go ahead and shut that all the way down, and then that way, whatever battery's left on it, it'll be there. So lastly, we're going to hear from Dr. Mark Belcastro. He's been practicing medicine for over 30 years. So this is someone who knows about these types of diseases that plague our land, and may not have known right steadily about this particular one because there's no cure. But I can guarantee you this: he's going to be able to share some information with you. I think that will enlighten you as it relates to this particular virus. But one question that's not on the list that Dr. Mark Belcastro has that I would like for him to answer, because I know that a lot of citizens have been asking this because they're getting a mixed message on social media, on the various websites, and that question is. And this can be the first question that Dr. Belcastro can answer before he gets into the list that he has. And that is, if a person has mild symptoms, what over-the-counter medications should a person take or avoid? Because there has been a lot of questions. Should you take Advil? Should you not? Should you take Tylenol? Should you not? So people have been having all these questions, and this is the person who can definitely answer that question for us. So, Dr. Belcastro, it's on you.
Good evening. I am very privileged and honored to be able to speak with you all and to help you through this time in this crisis. And thank you, Derek, for that introduction. So what I'll do is I will start with the question that Derek proposed. It is on my list. If a person has mild symptoms, what over-the-counter medication should a person take or avoid? So I think what has been floating around the internet, and even the World Health Organization leader made a statement recently about ibuprofen or those type of medications. And that was based on, initially, there have been some studies around flu, severe flu, people in the hospital who may have gotten worse on those medications. And then there were some social media tweets and things coming out of Italy about ibuprofen, and so that statement was made. So you have to understand two things. That statement was made on very little science or backing. However, when we're faced with those questions, there's two things you can do. The first thing is every individual has a different medical situation. So you may have to lean on your healthcare provider or some advice from a professional because, for example, If you have a liver problem, Tylenol may not be the best for you. In that situation, ibuprofen may be a safer way to treat your fever than with Tylenol. If you have kidney disease, you definitely would want to go for Tylenol. If you have neither of those and you have a choice and they're both on hand, then Tylenol would obviously be your first choice. You want to be careful, though, if you have a really high raging fever and the Tylenol takes it down a little bit, you don't want to continue to take it and overload your system and become toxic with too much Tylenol. So there may be situations where you may have to periodically throw in another one. So it's not a all or none question. It depends on the situation, depends on how sick you are, depends on your other diseases, and you always need to seek advice. But what you have heard is a statement to take note of, but it's not based on any known science around coronavirus or COVID-19 disease right now. So hopefully that helped. So one of my questions is, when did our team begin preparing for this? Like John, we did set up our command team, but before that, in late January, we just started sending out memos daily or every other day to our staff and our medical staff about what was going on in China as we were ramping up and making sure we were questioning people about their travel when they were presenting to our hospitals and our urgent cares and our offices and things like that. And then as the situation progressed, we started having more meetings, and eventually that led to us setting up a formal structure to address the pandemic. Why is coronavirus COVID-19 so serious for our citizens, especially the ones with respiratory disorders? I think you've heard those answers. It's you may have heard the word novel, which means new. It's a new virus. Coronaviruses are very common. They can cause a common cold. This is a different coronavirus that our human system has never seen before. So, like you've heard, there's no immunity. That's what makes this so different, and no vaccine. How are healthcare facilities across the region collaborating to work on COVID-19 crisis? I think you heard from John. If you think about your circle, if you start small, we have our local public health departments. We have all the hospitals in Dayton are organized under a name called the Greater Dayton Area Hospital Association. Sometimes you hear GDAHA. That system links us up with the Kettering Network and other hospitals in under GDAHA so that we can all communicate and work together and strengthen numbers. Then you go out to your state. We have the Ohio Department of Health, and then nationally we have the Centers for Disease Control, or you hear the CDC. So we rely on all of those resources to inform us and help us make our decisions and work together so that we're all working in synchrony. Does Miami Valley Hospital or any other premier hospital have the ability to test someone? So currently there is not in-hospital testing. We're sending our tests out to either the Ohio Department of Health or other laboratories that are set up to take our specimens. They have to be sent to another site. We do have a drive-through set up on the UD University of Dayton Hera Arena parking lot. So that is one area that we have stood up to help some of that testing on the non-hospital side of things, or what we call outpatient. Is the hospital set up to hold and treat a patient if someone came in with positive? Yes, all the hospitals are preparing special units and special teams that are a combination of infectious disease specialists, critical care physicians, respiratory therapists, and nurses that have special training on how to protect themselves and place the patients in closed units to take care of those patients. Says everybody is talking about personal protective equipment, or what you often hear the acronym PPE, personal protective equipment. Is Premier Health well positioned at this point? Again, like you've heard from others, we do assess our quantities of masks, gloves, gowns, and special types of masks every day, and we think of creative ways to allow them to last longer, and we assess that minute by minute and moment by moment, And again, we try to do all those things to prepare for the worst and hope for the best. And the best is what we're hoping for is, as you've heard those words, flattening that curve so we don't get into a surge that would lead us to deplete a lot of those supplies. There's a question about trauma hospitals and what role does that play. This is not a situation that's a trauma situation, but our high-performing hospitals, our trauma hospitals, those hospitals have specialized physicians in more abundance should patients get really, really sick and have to go on respirators and need a lot of other services. So we have those there to take care of them without having to move them to other locations. Making sure I got all of my questions for you. I think that covers my questions. So what I want to do is, you've heard a lot of great information on what you can do. And, you know, I hear that a lot. I hear people say, what can I do? What can I do to help you? What can I do? I often imagine a world in which everybody was doing exactly what they were supposed to do in the moment. And that would be all the things that you've heard our leaders here talk about tonight, in addition to what our governor has said. Imagine if everybody was hand hygiene, not touching their faces, social distancing, staying at home, not going to work if they were sick. We can flatten that curve. The other thing I want to leave you with is, as you are at home, if you're not a first responder and not essential and at home during this time, what can you do? What I have often told people and what I do for myself is when I wake up each day, there's a lot of things to think about. How many weeks is this going to last? How far out is this? How bad is it going to get? I focus on what I know, and I focus on getting through the day. So if I say, I just have to get through this evening, do my job, take care of people, communicate, get our work done around this preparation, I'll just get through this day. And I think for you, it could be some children to homeschool. It could be having to make a trip to the store for an elderly or for somebody in your family. Whatever you have to do, just say, what do I have to do today? My goal is to get through today and focus on what I know. The other thing I advise people to do is now it might be time, if you are able, to take up a new rhythm in your life. It could be journaling. I journal every morning. It could be a daily devotional. It could be just maybe 5 minutes of closing your eyes and deep breathing, if you don't have a lot of children bothering you, of course. But any type of rhythm that you can get into, because you want to take care, again, you've heard your health, your body. You want to take care of your mind and your heart. So take care of yourself, stay encouraged. There are a lot of very skilled people in this city, in this region, working to flatten this curve and to help you out, to keep you safe and to take care of you should something happen. So let's stay together, and thank you, and we're here for you.
Thank you, Dr. Bocastro. We certainly appreciate your wisdom. It's always good to have, as they say, a wise man among the group. So we certainly appreciate the wisdom and knowledge that you have over the 30 years that you've been practicing medicine. So thank you very much. I want to conclude with two additional questions. It's probably not additional questions, but it's questions that was asked previously that you, as we're doing live right now, probably missed because of the error with our computer. But I know that Felicia Hill is very passionate about mental health. So I'd like for Felicia Hill, the chair of the Dayton Unit NAACP Health Committee, to come up and tell us what should individuals do when experiencing mental health issues. This is something I know that's like a burning flame in her because she talks about it all the time. So Felicia, can you come up and share with us what individuals should do experiencing mental health issues? Thank you.
Hi, Felicia Hill, thank you. And thank you all who have participated in this town hall meeting and those who are offering tech support. Well, in a mental health, because your mental health is also your wellness. Without mental wellness or that you are experiencing, all the other things go by the wayside. But some of the things that you can do that's non-medicinal, that doesn't require medication, deep breathing, meditation, and isolation with our seniors is very crucial because they're already elderly and sometimes alone, and some of them aren't tech savvy, don't have access to the internet. Social media has been proven to be another vehicle that you can use. There's some websites that you can go to use your meditation and to interchange, and telehealth. See if your counselor is offering telehealth. But here locally, our crisis services, we have a crisis care at Dayton Children's is with Samaritan Health. That number is 937-224-4646. Once again, that's 937-224-4646. The other that we have here in Montgomery County that we can reach out to is 1-888-324-5052, and that is the crisis care hotline. Other situations that we have is the National Alliance of Mental Illness number that you can call. It's a 1-800-950-6264, and that's 1-800-950-6264. And then one other local person, Robbie Branda with Sunlight Village on 3rd Street. Her number is 937-640-1679. So, other things that we can do: eat healthy, exercise. Just like the doctor explained that we can do is get a new rhythm, develop this time to get closer with our in our faith and our relationships with our family. Look around the house at things that we have just forsaken because everything else has taken us out the way, and make those things a priority. So for our elderly or any person, just send an old school card, a greeting card of "I'm thinking of you, I care for you." And you don't have to go to the store to purchase it. You can make it personalized and just send a note in the mail. Thank you for those essential personnel that are still out working, our post office, those people in janitorial services, doctors, nurses, grocery stores, those individuals, firefighters, police officers, all those individuals that are out on the front line of this defense. We thank you tremendously, even our news reporters. So take care of your mental health, because our mental wellness is truly the foundation of our overall health. So thank you for this time, and I really appreciate you allowing me to be your servant.
Thank you, Felicia. Outstanding information passed along to the citizens of Montgomery County, Ohio, and abroad. I want to take this opportunity. We're actually the last person we're going to hear from is, his brother Jeff, who's actually hosting this town hall for us. Jeff Cooper, who is our health commissioner here in Montgomery County, Ohio. So he's going to have the closing words, and the closing words is, what is your message to the community today? He's working a lot of hours, him and his staff, and I commend him for a job well done. I commend our city leadership, because it's actually Dayton and Montgomery County combined health district. So I commend our mayor, Shelley Dickstein, our city manager. And everybody, our first responders, Chief Bill, Sheriff Streck, also the leader of our state, Governor DeWine. I also have been in conversation with Congressman Mike Turner, who is looking to pass some legislation, regarding, spending and seeing how we're going to help the individuals who are affected by this, from a monetary standpoint and from job creation, and for losing a job, I should say. So we want to make certain that that as we continue to put this puzzle together, that at the end of the day, when this puzzle all comes back together, we will still be the United States of America. And I want to share this with you on our website. If you can go to our website, you can have access to the World Health Organization, a lot of information there. You can have information from the Dayton and Montgomery County Public Health. There is information from the Center of Disease Control. So it's all right here in one place that you would have, and then you also can hear from our national president and CEO, Derek Johnson, as relates to what the NAACP feels are things that's happening to people of communities of color, and some action steps that we feel that our federal government can play. So with that, I want to call up Jeff Cooper to close us out. And once again, we thank him for hosting the Dayton Union NAACP. We want to thank our panelists, Felicia Hill, Dr. Mark Belcastro, and John Weimer for sharing their expertise in the healthcare field regarding this virus that is killing many Americans. And we just ask the Almighty God for his help to help sustain us as we go and walk through this valley. Brother Cooper.
I've used so much of this hand sanitizer lately that I'm starting to have irritation, but that's all right. I suspect many of us are in that same position, hey? Okay, well, certainly thank you, Derek, for, again, the opportunity, and I'd like to say thank you to our other presenters tonight as well. They truly are the subject matter experts that have communicated vital information to our community. So, boy, a common message for all of us. If you think about what's happened in the past, really a little less than 3 months, there has been a tremendous flood of information. You keep in mind, this virus was first reported out of China on December 31st of 2019. And so since that time, it has just been a never-ending rapid escalation of information and continually evolving situation. And sometimes it's almost overwhelming, and has the potential to create a tremendous amount of anxiety and frustration. But I think it's important that we all focus on what is staying constant. So we know how this virus spreads, right? We know the symptoms. We know what to do when sick. We know who's most at risk. We know how to prevent illness. We're all learning what's needed for social distancing, and we understand what that means. And we know that our response partners are working collaboratively throughout Montgomery County to make decisions, oftentimes in a very short period of time, but that are intended to protect all of us and ensure that we are healthy and safe. And so we need to do our part in terms of staying positive and focusing on what we need to do as individuals to do our part. So it's really about our collective efforts at leading by example. So be a role model. You know what you need to do to stay healthy and to comply with the governor's orders. So it's about all of us being role models, working towards the greater good, and making sure that we're taking care of each other. So it's really about all of us stepping up and doing the right thing. And no one ever said the right thing was the easy thing to do. But we have to make these difficult decisions in a very short period of time with the best intentions to protect the health and safety of all of us, because it's about us, it's about you, it's about your family, your friends, your neighbors, your coworkers. We're all in this together, and we have to protect each other. We have to do what's necessary to ensure that we flatten this curve to where we don't become like another country around the world or other countries around the world that have had significant numbers of deaths. So we're all in this together, and it's about each of us doing our part. So stay positive, do the right thing, and help all of us stay healthy and safe. Thank you.
Well, those are the last words of wisdom for today, but you got me back for just a quick moment, because I cannot leave this broadcast without doing this, because they're teaching me, folks. They're teaching me. Getting that little hand sanitizer, rubbing it on my hands real good. And then when I head back home, then we'll get up under some water and watch for a little 20 seconds and do those kinds of things. And as I started this teleconference off, I had this little gadget right here that's known as a temperature checker, thermometer. So I'm gonna, hey, let's see what's gonna happen here. So we got this, put it up to the forehead, and let's see what happens. Oh, 94.1. So it's kind of, it's kind of good, but I'm doing all right. We'll see y'all the next time. Good night.
You need to go to the hospital. Is it the thermometer? Yeah.